Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. If you're listening to this right now, you're probably a little stressed out. If you're not a little stressed out, you're probably very stressed out. It's March 22nd. We're living through a global pandemic right now. And here on the Wild Health Podcast, we've been talking quite a bit about the medical things you can do, what you can do to potentially avoid getting infected, what you can do to make sure you're optimized if you do get infected, and to physicians as well, what we can do to potentially treat this and mitigate this disease. But I want to talk about mental health today. So we have our Director of Mental Health, Dr. Kristin Dawson here. Dr. Dawson, thank you so much for having me into your home. It's a lovely home. I appreciate you having me here, especially in this time of social distancing.
Well, thanks, Matt. It's great to have you at home since we share this home together, and happy birthday to you. For those of you listening, Matt's been working around the clock pretty nonstop these days, and his birthday wish was that I contribute to the podcast today, so I couldn't say no.
Well, Dr. Dawson does happen to be my wife, but she's also our Director of Mental Health, and I've seen her help a lot of patients. You're an expert when it comes to this. You've helped thousands of patients, and I want to help more people by asking you these questions because I know you think about them deeply, you know the evidence, and you just have an incredible amount of experience as well. So I guess the first question I'll ask you is just, what are some strategies you're taking right now to enhance your stress resilience? It's a stressful time with 4 kids at home, your clinical duties and everything else as well. What are you doing specifically?
Okay, well, you're right. I do think about this quite a bit, both professionally in terms of treating anxiety and trauma disorders, but also just personally. I've been somebody who for my entire life has had to manage anxiety. So I have learned some things that work for me, some things that work for other people, but try and ground myself in what the research says about how to mitigate the effect of trauma, stress, adversity on people, and what they can do to weather the storm and come out, healthy, well, and with their mental health intact. So I'll talk about some of the things that we've been doing personally within our family, and they're going to kind of line up with what I'll sort of outline as the Wild Health Stress Resilience Plan for those of you who are listening. So the first thing I think about are ways that I can actively cope with what's going on around me. And like I said, over the years, I've found that there are certain things that are tried and true coping mechanisms for myself. At the top of the list would be meditation. Second probably is yoga. Next would be running outside, trail running. And if that's not possible, having to do it on a treadmill. And so I know that those are things that I need to continue to do, and maybe even bump up in terms of the the time that I'm spending doing those activities. So the beginning of each day, I get in at least 15 minutes of meditation, if not more. And that's been a really important thing to schedule in before the kids wake up in the morning. Sometimes it does mean having to set the alarm a little bit earlier and maybe not getting quite as much sleep, but I do think that it's been a pretty big factor for me. Now, we do have kids, and they are going through this as well, right? So what I've also been thinking about is, how do I use this as an opportunity to teach our kids their own form of coping skills? So one of the things that we've incorporated into our daily schedule is time to introduce at least 2 new coping strategies. And then our girls are kind of journaling afterwards, and they've come up actually with their own rating scale as to how helpful each of those skills was that day. So far, I can tell you that the quieter meditative practices are getting low ratings from them, and things that involve dancing and more active movement are always going to be sort of at the top of their list of more helpful strategies. But that's great, because they are starting to recognize within themselves, what are things that help me feel calmer, better, safer, more energetic, and what are things that maybe aren't quite as helpful. And obviously, as we move forward, the things that they're rating really high are going to be things that we encourage them to practice in a time where they really need it.
Didn't you say Madeleine's ranking the meditation a half star so far every time?
Yes, so one of my favorite meditation apps is Headspace. I will say that there is a student section or a kid and family section there that has developmentally appropriate meditation guided exercise for kiddos. So, depending on the ages of your kids, you can find things that would be the kind of right amount of time for them and stated in ways that are very understandable for them. But yes, our 10-year-old is not a fan of Andy and his voice. When she hears his voice coming through the speakers, she groans, which, obviously, I really like Headspace, so no offense to those folks. But yes, she has been giving it a half-star rating pretty consistently. But our other daughter, Avery, actually has had some positive feedback for it.
So one thing I'll say about the setting alarm and getting up early, that is not a Wild Health approved strategy. I mean, if that's the only way to get it in, great. But if you live at home with a partner, I would suggest really talking about giving each other a break. This is 15 minutes that we're talking about. So if you have kids and you need a break, engage your partner in this. If you don't have a partner, or you're a single parent at home and you really got to have that time to yourself, I mean, honestly, the benefits you get from 15 minutes of meditation, it may be worth a little bit of screen time, letting the kids watch something for a few minutes, because you really should get this, and sleep is critically important as well. So I would say that setting the alarm and getting up earlier would be a last resort option. What does research, I know you are very evidence-based in everything you recommend, what does research tell us maybe some beneficial strategies?
So another strategy that we're trying to be purposeful in is a time to focus on cultivating optimism and just positive emotions in general. So that's not to say that we're ignoring times where we're feeling overwhelmed or sad or anxious. Rather, it's scheduling time or having a daily practice where we can focus on things that make us feel better. So for us, obviously, and a lot of other families, family meals are sort of the norm now, right? So everybody's eating dinner together again, or most people are having time where they're able to eat dinner as a family. So before a meal, praying, and then talking about the things in that particular day that we can stop and be grateful for and name. And this is an activity that even our littlest child can participate in. And then I would say scattering throughout the day, just times for sharing positive emotions. So I'll give an example of a video that our Montessori teachers sent out to the kids. Very sweet, very thoughtful. They're thinking of our kiddos and missing them. But these sweet teachers at the end of the video had some technological difficulties. They couldn't figure out for the life of them how to stop recording. And so there's about 5 minutes of them fumbling and getting really frustrated and, trying to figure out how to stop recording. And for whatever reason, my kids and I found it really, really funny. And so sometimes we'll pull that video up and get a good chuckle out of it.
So the gratitude, I think, can be really simple. I mean, just like you're talking about sitting down to eat, if you just make it a part of when you sit down to ask everyone what was your favorite part of the day. You don't have to say list what you're grateful for or make it a really formal thing, but just something as simple as that could really help, especially kids, to be thinking about the things that happen good in the day. What other strategies?
So this next one involves taking some time to evaluate how you're thinking about this situation and focusing even just for a moment, whether it's by journaling or talking with your partner about the silver lining in all of this or the small positive thing that could come out of all of this. So an example, I guess, would be we just moved to a new house right before the pandemic, and now we're spending a lot of time in our house. Well, okay, we've got an opportunity to unpack boxes and to hang up pictures. That's a small win, but I think in this time, it's important to focus on the things that, are small but good. Another opportunity is, again, teaching our children and modeling for our children how to cope in a time of adversity. So again, going back to being sort of pushed to teach our children explicitly how to cope when you're feeling overwhelmed. And now that we're home and we're homeschooling, we're able to do that every single day. Another sort of opportunity in the midst of all of this is, again, to serve our patients. So acknowledging that we do telemedicine and how perfect is telemedicine to reach out and to connect with patients during this crisis. So again, it's finding the ray of sunshine or the small pocket of positivity in the midst of the larger stressful situation.
Yeah, I was just talking to our 8-year-old this morning, and we've wanted to have a garden for the last couple of years and just really haven't had the time, and now we definitely have the time, and it's planting season. And we were also talking about how the last time there was a global pandemic, the Spanish flu in 1918, 100 years ago, they didn't have the same level of medical care that we have today. They didn't have the same level of communication. There weren't all the tools to cope with it like there are now. So we were just talking about how fortunate we are to live through a pandemic today rather than the one 100 years ago or the one before that or the one before that. So as bad as things are, we do have a lot to be grateful for and thankful for if we do some cognitive reframing like that. What other strategies are there, Kristin?
So this one I think a lot of people have already been talking about, but important to emphasize is that we are social beings, and despite the social distances, we have a drive to connect with other people, and that's actually sort of social connectedness and receiving and giving social support has positive mental health and physical benefits for people. So just as you said, there are ways we can connect with other people virtually right now. And so how wonderful is it that we have options to FaceTime and to call and text and use social media and other ways to connect with other people in a time where we physically can't be next to one another. So the way that we've implemented sort of social connectedness in our house is, number one, in the morning, Matt and I have set aside some time before most of the kids are awake, just dedicated time to talk with one another about what's going on, about how we're doing, and making that a regular part of our routine. And then I would say another example of how we're doing this is scheduling in FaceTime with family members who aren't physically close to us. So yesterday, for instance, our girls decided they wanted to put on a play, and so they rehearsed all day long, and we let the cousins and grandparents and aunts and uncles know we'd be FaceTiming them later, and we had a kind of a group FaceTime, and they were able to see this little play that the girls had put on. So that's just an example of how we are taking steps to support one another, connect with one another without being physically next to each other.
Yeah, I think we should be talking about physical distancing, not social distancing, because we can be really social without being next to each other in proximity. And last I heard, we can't really spread this through Facebook or through Wi-Fi signals. So not a reason to be less social, just less physically close.
So the last strategy that I've tried to think about is really sort of harnessing our purpose and connecting with our faith and spirituality. So the way that we've implemented that here is sort of professionally, on a professional level, again, thinking about how I can serve people who are experiencing anxiety, who are experiencing maybe a decline in their mental health during the midst of this, and realizing that both my own experience with anxiety myself, and then the professional focus on that sets me up really nicely to reach out and to be a part of helping other people. For me, that's really meaningful, and that sense of purpose is something that helps people, myself included, get up in the morning and face the day. And so I would sort of encourage people to think about ways in which they can harness their own sense of purpose. And if it involves helping other people, that's sort of even better. That gives you a boost in terms of connecting with an altruistic part of yourself.
So those are things that you're doing personally, and all sound like great recommendations. What does research tell us specifically, maybe some beneficial strategies, or what does the evidence tell us about those strategies?
So research in the field of stress resilience has given us some guidelines in terms of 5 factors to try and focus on that have been associated with a better response to stress and trauma. So the first one is active coping strategies. So resilient people are people who are not necessarily ignoring what's going on around them, but they are taking action to problem solve. They're kind of going into a planning mode, and they're using coping strategies that can include physical exercise or meditation, tai chi, yoga, those kinds of things. The second factor is people who are resilient tend to cultivate optimism and engage in positive emotions. So again, this isn't to say that you're not going to feel and experience negative emotions. Rather, you can take some time to foster positive experiences, whether that's sharing a joke with somebody, whether that's watching a funny video, whether that's journaling about something really nice or lovely that happened in the midst of all of this, and then sort of rereading that journal or sharing that funny joke again later that day, so that you're spending at least a portion of your day experiencing something joyful or kind or loving.
So the next time I get in trouble for sending an inappropriate meme or joke to you, then I'm going to quote the evidence in the literature?
I guess I have to say yes to that. So the third strategy is to engage in something called cognitive reappraisal. And basically what that means is identifying the way that you're thinking about a situation and seeing if there's any way to turn some of that into a positive, or at least into a less negative way of thinking about a situation. This is something that probably doesn't come naturally to a lot of people. And in fact, there may be some genetic factors involved in sort of how often you're doing this or how easy it is to do this. So that's where You may want to engage a therapist, a cognitive behavioral therapist to help you with this. But if you're able to, again, try and view what small positive factors are involved in the greater stressful situation. Maybe write those down, maybe reread those to yourself throughout the day if you're able to. The fourth strategy is, again, to be social, not physically social, but virtually social. That's going to promote your resilience. That's going to have really positive effects on your brain's reward circuitry. So if you want to schedule that time to connect with friends and family members by video chatting, calling or texting, that would be a great strategy to engage in. And finally, the fifth factor is, again, harnessing your purpose. So what is it that you feel like you are placed on this planet to do, to be, and how can you connect with that sense of purpose during this time of crisis? How can you use the skill set and the life experiences and what you have as a person to offer the world in the midst of all of this? And if nothing is coming to mind, let me suggest that if you are a caregiver of a child, if you are simply a very important person to a child, let me encourage you that could be part of your purpose. So what we know about kids and kids who are going through really, really difficult things during their development is that if they have a close relationship with a caring adult, that does a lot to mitigate the negative impact of that stressful situation on their overall growth and development. So again, if you're a teacher, if you're a spiritual leader, if you are a neighbor, if you are a friend or an uncle, and you have a really close relationship with a child, find ways to let them know that you are caring for them, that you're there for them, that you're thinking for them. And if it has to be virtually, then so be it. But that would be a very important role that you could play during the midst of this to protect our youth from the negative effects of this pandemic.
So all the things that you said earlier you were doing, those are evidence-based things that there are clear studies showing the positive benefits of those. So that makes sense now. So just to reiterate and recap those, you want to kind of double down on the meditation, being active in trying to de-stress and be resilient. The cognitive reframing, you could just have a competition at home who can come up with the most silver linings with the situation. And then identifying your purpose. It sounds like those are the big ones that the evidence shows are going to have a positive benefit. The reason I really wanted to, it kind of got me thinking I need to talk to you in this time too, is a study that I saw that I sent to you about PTSD. It was something, the headline was something like 30% of people who get the SARS-CoV-2 virus will have PTSD from it, which was a really striking number. Are people actually at risk for PTSD? Are we going to have an epidemic of a global pandemic of PTSD after the viral global pandemic?
Well, that was a really negative way to frame that question. But what I would say is, as a psychiatrist, I think I can't not be concerned about the mental health impacts of the global pandemic on society and on people. The Lancet just published an article February 26th that talked about and reviewed kind of the bulk of these negative psychological effects on people who were quarantined during this particular pandemic. And certainly they outlined that they're concerned about what will happen, that people are already expressing and experiencing PTSD type symptoms. So I think it is something that we are going to have to screen for and watch and then actively treat. What I would say is that don't panic necessarily if you're experiencing a negative reaction to what's going on around us. That doesn't necessarily mean that you will go on to have PTSD. What I would encourage you to do is take stock of how this is impacting you. it would be pretty normal to feel stressed, to feel angry, to feel confused about all the information coming out, to have trouble sleeping, to have trouble focusing and concentrating. Those are all sort of normative reactions to a stressful situation. What you want to also be aware of, though, is are those symptoms lasting for a really long time? And are they significantly impacting your ability to carry on with life? Whether it's caregiving responsibilities for your family, whether it's, interacting with your work in a meaningful way, and kind of completing your work responsibilities, whether it's just caring for your physical environment at home. If your trauma symptoms are impacting those things, that's where it would be really important to reach out and to try and get support from a mental health professional. What I can tell you is that psychiatrists and therapists and social workers have been using telemedicine for a long time and effectively. So we are actually set up really nicely to provide treatment from a distance. And there's evidence that treatment over video chat is just as effective as in-person treatment. So please don't let that be a barrier to reaching out and asking for mental health treatment. I think one of the, concerns would be that you would try and kind of stay at home and hunker down and not reach out for help. There is definitely help available for trauma, for anxiety, for depression. And again, it can be just as effective done through telemedicine as in person.
So what you're saying is if you're panicked, don't panic about your panic because it's normal to have negative emotions surrounding this. It's really PTSD if it's negatively affecting your work, your life at home, other reasons, and that's the time to really reach out for help. But all of us are probably going to have some negative emotions related to this. What about those with mental health problems before this, people with depression, anxiety? It makes sense that they would be at higher risk. What do you recommend for those individuals?
Well, let me take a step back and just say, I was working with somebody just last week, and we were doing cognitive behavior therapy, and she was feeling better. She had been struggling with anxiety, with depressed mood, and one of her thoughts, understandably, was, I was just feeling better, and now this hits. It just feels like, the world's against me, and I'm going to be right back where I started. And so kind of keeping in mind that cognitive reframe, one of the things that we tried to work through was, number one, thank goodness you are already on this path towards treating your anxiety and depression. Number two, you've already found strategies and skills and developed those skills to improve your mental health. And so it's actually an asset that you've already started this process and that you know that you can turn to those skills right now. So I would just say, if you've already been in treatment for your mental health, think about what helped you in the past. Think about what you learned from those prior experiences and return to what's been helpful for you. If that means reconnecting with a previous therapist who was really effective in working with you, great. If that means, refocusing on getting 30 minutes of exercise per day, getting, really stringent about your sleep regimen and really focusing in on nutrition, wonderful. Do those things. If it means that there was a medication that was very helpful to you, reach out to your provider and see if it may be appropriate to return to that. But I would say, again, be proactive in identifying if your mental health symptoms are returning and think about what was helpful in the past, and don't hesitate to reach out. As I said, mental health providers are very used to, in many cases, working with patients from a distance. And so let's not make that a barrier to care.
All right, so that was super helpful. I mean, I think as we're debating the risks and benefits of hydroxychloroquine and azithromycin and whether or not you should be supplementing with zinc and vitamin A and vitamin D and how much and all these things, you've given us some really practical things that really have no downside. I mean, doubling down, focusing on your meditation and being active and your stress reduction, exercising, cognitive reframing, looking for the silver lining, thinking about what's your purpose and focusing on that. Those are evidence-based things that science shows us are going to have a positive benefit, and I don't really see any negative downsides to those. So if you have questions for us related to mental health, Dr. Dawson is double board certified in adult and child and adolescent psychiatry. She was the smartest and prettiest student in our medical school class, although the prettiest part probably means less to you. But we'll have her back on to answer. She's blushing here. We'll have her back on to answer your questions, whether it's about your kids or yourself or whatever you're wondering, just about stress resilience, or if you've seen an article or something else. At Wild Health MD, you can send those questions, Facebook or Instagram. And thanks for listening.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.